Hi everyone, good afternoon. Welcome back to another session of Cancer Care at American Oncology Institute, NRI Mangalagiri. Here we have with us Dr. Kalyan Chakradhar, Surgical Oncologist. Good afternoon, sir.
Good afternoon.
Welcome to the show. And what is oral cancer, sir?
Oral cancer constitutes cancers which occur in the oral cavity proper and in the oropharynx. If you see the oral cavity proper of the mouth, it constitutes lips, both upper and lower lips, the inside lining of the lips and the cheeks, which is known as the buccal mucosa, anterior part of the tongue, upper and lower gums, and the floor of the mouth. So this constitutes the oral cavity proper. And if we see the oropharynx, or which we regard as a throat, it constitutes of the soft palate, the tonsils, and the posterior wall of the pharynx. So any cancer which occurs in this part of the oral cavity proper or in the oropharynx, they are together considered as an oral cancer.
Okay, sir. And what is the burden of this is in India, sir?
Oral cancer is one of the most common cancers in India, and if you see, it is the most common cancer which occurs in the males. If we combine both genders, both males and females, oral cancer is the second most common cancer in India. And every year, around 8 lakh new cases of oral cancer are being diagnosed in India. And India alone constitutes around 30% of the global burden for oral cancer. And if you see the gingivobuccal cancer, this is the most common cancer in India. So, and this cancer is peculiar in a way that it is most commonly seen in Indian population because of that habit of keeping the gutka or chini in the gingivobuccal sulcus. And it is also regarded as an Indian oral cancer. So on a note, the incidence and prevalence of oral cancer is pretty much high in India.
Okay, doctor. And what could be the risk factors for this oral cancer, sir?
There are many risk factors for the oral cancer, and particularly it's lifestyle factors, environmental factors, and the host factors. So these are the three most common groups which constitute a risk factor for oral cancer. Those lifestyle factors: cigarette, use of tobacco or tobacco products, their usage in any form, it is considered as a risk factor for oral cancer. And like the usage of tobacco products in the form of gutka, chini, or usage of betel nut for chewing, smoking of cigarettes, so they are all considered as a risk factors. And in addition to it, if a person also has the habit of consuming alcohol, they have both tobacco and alcohol, they have a synergistic effect. So it increases the person's risk of developing the oral cavity cancer. And along with these lifestyle habits of smoking and tobacco, poor dental hygiene or poor oral hygiene with dental caries, and repeated trauma to the cheek or tongue because of the sharp teeth, use of spices, much spicy food. So they are all considered as risk factors for oral cavity cancer. In addition to that, recently we are seeing an increased incidence of oral cavity cancers in people who do not have any of these addictions, like addiction of smoking or addiction of habit of consuming alcohol. So such people, they can ask that I don't have the habit of either chewing tobacco or smoking cigarettes or alcohol, but still I developed an oral cancer. So in such cases, we are seeing an increasing incidence of HPV infection. HPV infection is a human papillomavirus infection. So when there is this human papillomavirus, especially strains 16 and 18, so when a person is infected with these virus, they are at an increased risk of developing oropharyngeal cancers.
So with all these risk factors, and what could be the symptoms for this oral cancer, sir?
The most common symptom for the oral cancer is a persistent ulcer in the oral cavity. So usually any ulcer in the oral cavity, it heals within 3 weeks. So any non-healing ulcer in the oral cavity for more than 3 weeks is one of the first signs for the oral cancer. Along with this, the other signs and symptoms could be difficulty in opening the mouth, or when there are any persistent white or red patches, which we usually tell as leukoplakia or erythroplakia. So they are considered as pre-malignant conditions. So when leukoplakia or erythroplakia are present for a longer duration of time, they can turn into an oral malignancy. When there is a difficulty in chewing, swallowing, or when there is difficulty in protruding the tongue or moving the tongue outside, so that can also be a symptom for an oral cancer. Any change in voice, any intolerance to spicy foods, excessive salivation. So they are all considered as some of the symptoms for an oral cancer.
Okay, sir. With all these symptoms, how can oral cancer can be diagnosed, doctor?
So patients usually come to us with any of these symptoms. So we do a proper clinical examination of the oral cavity and the oropharynx. So if you can see any visible lesion in the oral cavity, we do a biopsy of the lesion. So by doing a biopsy of the lesion, we can come to a diagnosis of whether it's a cancer or not.
Okay. And what are the stages of oral cancer and how the staging will be done, doctor?
So once we arrive at a diagnosis of a cancer in the oral cavity, we usually try to stage the disease. So the staging of the oral cavity cancer is usually done by radiological investigations. Usually these oral cavity cancers, they spread to the lymph nodes in the neck. So whenever we do a radiological investigation, we will evaluate the oral cavity proper along with the neck and the most common site of metastasis, which is the lung. So for the oral cavity, the most common investigation which we do is the contrast enhanced CT scan of the oral cavity. So in a contrast enhanced CT scan of the oral cavity, we evaluate the primary tumor site, which is the oral cavity. Along with that, we also evaluate the neck for the lymph nodal metastasis. So if in any cases where we suspect a distant metastasis, we can also go for a CT chest. Or in cases where it is a recurrent case of an oral cavity, we can always do a PET CT scan. So after doing these radiological investigations, we usually arrive at a stage of the oral cancer. So there are usually 4 stages of oral cancer, stage 1 to stage 4. Stage 1 and stage 2 are regarded as early oral cancers. So these early oral cancers are stages where the cancer is limited to the oral cavity and it has not spread to the neck. Stage 3 is a stage where the tumor has spread or the cancer has spread to the oral cavity. And stage 4, we have stage 4A and 4B, which are considered as a locally advanced stages, where the tumor involves adjacent structures in the oral cavity. And stage 4C is a metastatic stage. So the tumor has already spread to the other metastatic sites like lungs.
So what are the treatment modalities for the oral cancer, doctor?
When we come to the treatment modalities for oral cancers, it is usually surgery and radiotherapy. The surgery and radiotherapy, they are considered as a definitive treatment modalities for oral cavity cancer. Usually stage 1 to stage 3 oral cavity cancers can be treated either by going for a surgery or a radiation. So for whenever feasible, we have to see for the tumor factors, the patient factors, and whenever the patient is considered fit for surgery, we usually take up the patient for the surgery. Surgery constitutes the wide excision of the lesion. So we need to do a wide excision of the lesion in the oral cavity along with the excision of the lymph nodes. So we also do a neck dissection, and after removal of the lesion along with the neck dissection, we try to do a reconstructive procedure. So because oral cavity is a very important organ of the human body, so after removal of after doing a wide excision, there will be a cavity or a large area of a large lesion which will be left over. So for this, we do a reconstruction by going for a plastic surgery. So we take either a pedicle flap or a free flap.
What are the recent advances of surgical management in oral cancer?
So coming to the recent advances, the main aim for the treatment of for previously the main aim for the treatment for oral cavity cancer used to be the cure for the cancer. So nowadays, with the recent advances which are available, we are trying to preserve the form and function of the oral cavity, because as the oral cavity is a vital organ in the day-to-day life of the human being, we try to preserve the form and function of the oral cavity. If the lesion is of such a big size that a large area has to be removed, we try to restore the form and function. And after the treatment, we need to give a good quality of life to the patient by decreasing the morbidity of the treatment. So with these aims of the treatment, there are many changes which have occurred in the surgical management of the oral cavity cancers. So previously, for any buccal mucosa cancer, irrespective of whether mandible is involved or not, the entire half of the mandible used to be removed. So, and then the reconstruction used to be done with a PMMC flap. But nowadays, because of these latest CT scans which are available, we can come to a precise conclusion whether the mandible is involved or not. If the mandible is not involved by the disease, and if we are removing the mandible only for achieving a negative margin, so we can get away by removing a rim of the mandible. Rather than removing the entire mandible, we remove only a rim of the mandible so that we can preserve the remaining part of the mandible. So that helps in preserving the form and function of the oral cavity. And later, the reconstruction part. Previously, the PMMC used to be the most common flap which was used for the reconstruction. But nowadays, we can also use a free flap transfer. So we use a free radiolateral forearm flap from the patient's forearm, or we can also use an ALT flap from the patient's thigh. We keep the tissue in the oral cavity of the patient and then do a microvascular anastomosis. And sometimes in a selected patients, even if the disease burden is high, where we had to remove the mandible of the patient, even then the reconstruction of the mandible can be done by using a free fibula graft. So we take a fibula from the leg of the patient, we keep the fibula in the place of the resected mandible and then do a microvascular anastomosis, so that we can reconstruct the mandible. So these are all the recent advances which have been come up in the field of the surgical oncology for the management of oral cavity cancers. So with the help of these latest techniques, we can decrease the morbidity of the treatment so that the patient can be able to live a good, they will be having a good quality of life after getting treated.
And how screening will be done in oral cancer and how it is useful for the patients, doctor?
Because as we can see, most of the oral cavity cancers which we see in India are lifestyle related. So they are because of the habits which the patient have, like smoking, alcohol. So when we have this high risk group of people who are more prone to get affected with oral cavity cancer, screening plays a very important role. So for screening of the oral cavity cancer is a very simple procedure. The patient needs to stand in front of the mirror and examine all the parts of the oral cavity which I have mentioned. So he has to stand in front of the mirror, examine his lips first to see for the presence of any ulcers or white or red patches, then see the inner lining of the lips and the cheeks. So after examining of the inner lining of the cheeks and the lips, he needs to open the mouth, see his tongue, whether there are any visible ulcers or patches, move the tongue up and front and inspect both the borders or both sides of the tongue, and then along with it he also has to inspect the gums. So he has to inspect all the parts of the oral cavity in front of the mirror. Look for any visible ulcers, white or red patches. If there are any visible ulcers which are not healing for more than 3 weeks, especially in these high risk patients, he should immediately consult a local doctor so that if the lesion appears to be suspicious, a biopsy can be done and a cancer can be diagnosed at an early stage. So if the cancer is diagnosed at an early stage, there are high chances of completely curing the disease with a less morbidity.
Thank you, doctor, for your valuable information regarding oral cancer. Thank you, viewers, for watching this live session. If you have any queries, please post us in the chat box or chat with us in a messenger. Thank you.